All right, we are going to get started. So thank you everyone for joining today's webinar, which is Decreasing Your Risk for Falls After a Brain Injury. My name is Rachel Ishak, and I'm a Community Outreach Specialist at the Brain Injury Alliance of New Jersey. We are a nonprofit organization with a mission to provide education, awareness, prevention strategies, advocacy, and support for those who've been impacted by brain injury. I want to announce that we have our upcoming 5K run, walk, roll for brain injury awareness. We have two happening this Saturday at Paramus and Mount Laurel, and our 5K run walk is going to be at Bradley Beach on October 5th, which is next Saturday. You are still welcome to sign up if you haven't done so already. I'll put the link in the chat. And we also have some webinars that are coming up. The next one will be on October 1st on the topic of estate planning and trusts. So you're welcome to join us for that. And then we have a couple more scheduled for the rest of the season. And you can see all of these on our tab on our website, which I've also put a link to in the chat. So you can register for all of them at one time and see them of what we have coming up. So just a few housekeeping notes before we begin. The attendees' microphones have been muted, so if you have questions during today's webinar, please type them into the Q&A box. We'll get to as many questions as possible at the end of the presentation. The webinar is being recorded, and you can view it afterwards, either on the BIANJ website, or we also send a link out to it in a follow-up email for those who've registered for this webinar. At the end of the webinar, there will be a link for a post-webinar survey in the chat. We really value your feedback and we read every single one of these, so please do complete the survey if you're able to. You have to complete the survey in order to receive a certificate of attendance if you're looking for that. And so once you complete the survey, you'll automatically receive the certificate of attendance via email. So now I want to welcome today's presenter, Marvelyn Tiziani. Dr. Tiziani's passion for physical therapy began at a young age. After suffering multiple ACL tears, ultimately ending her ballerina career, she was inspired to pursue a career in rehabilitation. Marvelyn earned her Bachelor's of Science in Health Science at Monmouth University, graduating cum laude in 2017, and her Doctorate of Physical Therapy from Kean University, graduating cum laude in May 2021. Dr. Tiziani then went on to become a board-certified specialist in neurology physical therapy in March 2023. She has earned multiple certifications, including NASM Personal Trainer, NASM Corrective Exercise, NASM Behavioral Change Specialist, MOSS Cycle, Rock Steady Boxing, PWR, LSVT Big Cert, 200-hour yoga training teacher, Love Your Brain, and others. Marvelyn loves anything that has to do with exercise, and her goal is to improve quality of life and prevent injury for the most amount of people she can. Marvelyn enjoys working with those with neurological diagnoses, including those who have suffered brain injuries. So with that, I am pleased to welcome Marvelyn.
Thank you. It's a pleasure to be here today with all of you. I'm going to pull up my slides now so we can go through it. So, like she said, my name is Marvelyn Tiziani. I'm a PT in Central Jersey. I work with a plethora of people with different diagnoses. But one of my favorite things overall, no matter what diagnoses, is reducing someone's risk for falls. So I kind of go through today about what increases your risk for falls and then ways that we can decrease that risk. So I highlighted here some reasons that we have an increased risk for falls. Notice that there's a lot more in green than in black. And the ones in black are really not necessarily that changeable. We're going to keep increasing in age. If you have a fall history, you can't erase your fall history. And some cognitive impairments may put us at a higher risk for falls, and those aren't really that changeable. That being said, you can see all the things we can change, such as poor safety awareness. We can definitely improve that. There's so many reasons for dizziness, and we can definitely reduce that. Dehydration, risky environment, weakness throughout the body, impaired gait, so how you walk, poor balance, which is more of the obvious one, medication side effects, a feigning or history of passing out, and improper footwear. So there's so many ways that we can increase our risk for falls, but on the plus side, reduce our risk for falls. And we'll go through these a little more specifically. So fall risk in those with brain injury. So as the ones I just stated, there are some additional ones specific to the diagnosis of having a brain injury. So muscle tone, a lot of us can have different changes in our tone of our muscles after a brain injury. It can become hard and rigid, increased tone, or some muscles can become flaccid and have less tone. In both scenarios, they can increase our risk for falls, but there's many ways that we can manage our tone, no matter what spectrum of tone we're on. After a brain injury, dizziness is a very common symptom. It could be acute just right after the injury, or it can be more of a long-term chronic issue. Even if we can't necessarily correct the true cause of the dizziness, there's many techniques we can use to habituate and make our brain and body used to the dizziness that will decrease our risk for falls. Cognitive impairment. So if we have any memory issues or anything like that, there's a lot of things that we can do to improve on. So I know I said on the previous slide that sometimes there's part of that we can't change, but there is also a lot of that we can change and alter to decrease our risk for falls. Altered balance. We'll kind of go through later in the presentation different types of balance and how each one will affect us differently. Do you feel yourself falling or feeling unsteady if you're static and reaching for something, or is it when you're walking, or is it when it's dark? There's different situations, and that can help us reduce our risk when we know our challenges. Stress. So having any injury can be very stressful to the brain and the body. Having stress and having that increased of fear of falling could definitely increase our risk for falls, which we can show ways to decrease our stress. Medication side effects. Almost every medication side effect I know of has some risk factor of orthostatic hypotension, which is when you go from sitting to standing or laying down to sitting, you do those changes in elevation. Our heart rate will go low, and then you can get the sense of lightheadedness and dizziness, and that in itself could cause you to pass out or lose your balance and fall. And there's ways to manage that, kind of like the dizziness. We get from more of a physician side, we can alter the medication, and we can physical therapists, we work with the physicians to help say, well, this is their side effects with this. Is there something different that the person could benefit from? As well as habituating to the orthostatic hypotension, making your body used to it so that the symptoms of it are less. Activity restrictions, it's a very strong principle through physical therapy of all sorts, kind of the use it or lose it principle. So if we become more sanitary, become weaker, we stop practicing certain balance tools we use just with daily activities, and then that can increase our risk. I kind of talked about fear of falling along with the chronic stress. I always say fear of falling is that seesaw. We need a little bit of fear so we're not overconfident and just, doing things that are like, I know my limitations. I know I'm not going to stand on a ladder and try to get something from the top shelf because I don't feel safe doing that. And we all have different limitations. But on the other hand, if you're too fearful, that in itself can make you fall or increase your risk for falls. So it's finding that balance of a fear of falling. And another one I wanted to point out was neuropathy. Neuropathy is a change in sensation in our limbs. In terms of balance, we're going to be talking about our legs. So if you have numbness, tingly, even pain in our feet, that's a sensation change, which then alters the perception of where our feet are in space. So, if you find yourself tripping, not necessarily falling or stubbing your toe, this could be one of the reasons that you're not clearing your foot enough to get over an object or around a corner, because your brain needs to be retrained of where our feet and limbs are in space. So I know that's a long list, but now's the good part. We get to say, how we can reduce our risk for falls. So we're going to go through each of these. I found personally that with my clients, this is the um, kind of the categories I break it up into. I would like to say that, you know, it always depends on someone's individual needs, and these are very generalized things, but they're points that will help all of us. Even if we think we have a very small risk for falls, there are definitely things to consider. So the first one's our home environment. All environments matter. We'll go through each of these a little bit more in detail, but home environment is important since you, we are at home a decent amount of the time and we have more control over our home environment. Sure, there's a lot of risky curbs and other things outside the home, but we don't necessarily have as much control over that. We can go around them and try to avoid them, but there's more control in our home environment. Improving safety awareness. Again, we'll go through this more. Safety awareness is knowing your safety, your limitations, and the ability to choose a better route. So if you came up to this curb that was very steep and maybe had cracks in it, and it wasn't even, and it looked like it needed to get paved, could you make that connection to say, is there another part of the curb I can go up, or is there a ramp? Third is strength. Our strength, we use our muscles to allow us to prevent a fall. I say often that we'll always lose our balance a little bit. That's just life. We might feel a little wobbly, we might reach for something and get a little off balance. But the true thing we work on is the ability to regain our balance without resulting in a fall. And that's where strength comes in. Improving proprioception. So proprioception is what I was connecting to neuropathy with. It's that deep sensation of where our joints are in space. So can you feel your foot on the carpet? Does your carpet feel different? Different textures of flooring? What shoes are we wearing that with and how they feel on our feet? And lastly is the vestibular system. So the vestibular system is, people always reference it, it's our dizzy system, it's our equilibrium. So it connects our eyes, our brain, and our inner ear. It tells our head where we are in space. So I use all the systems of vestibular to look up, down, turn around to gravity. And, if we're dizzy, this system also becomes impaired. Often it's the chicken or the egg situation. Are we dizzy because our vestibular system's impaired, or is our vestibular system impaired because we're dizzy? Regardless, we can improve them. So I'm going to go through these a little more in detail. First, we'll start with the home environment. So first things first, things that are loose on the ground. So if you're one of those that will throw your clothes on the ground, I've definitely been a culprit of that before, or have loose area rugs, or a shower mat that isn't really stable that can slide on the tile. Those are probably good ideas to remove. Anything that moves, well, it's basically creating ice in your house. You can slide on that ice so quickly and you can go down really quick. So if it's a rug or clothing or a bath towel, anything like that you're able to remove from the environment, that would be really helpful to just decrease the risk of slipping on something movable. Next is adding rails. A lot of times I see people tell me they fall on stairs. And if I say, oh, how do you do on stairs? They're like, I can do it, but I need to hold on. That being said, I don't want you to have a death grip on the rail, but I say we should all use rails. It takes 1 second to slip your foot off a stair, and often you can hit your head. So we always want to add rails. It can be for a full flight of stairs in your home. It could be for 2 or 3 steps to enter your home, or maybe you have 1 step to go into a different room in your house. I would always recommend adding a rail where you can. Next is adding night lights. So vision is a big thing we do and use to have balance. Our visual, how we see the world, helps us with our balance. So if it's you get up and go to the bathroom at night and you don't have night lights, or you don't have any lights, you're taking away one of your resources for balance. So an easy solution is adding those little night lights. You can add into the wall, a little plug, and just give some light for situations that the room is dark or the hallway is dark. Next is a bed rail. This is more individualized. If you feel, I know sometimes some medications can have you hallucinate or be on have different dreams. And sometimes I have patients that will get up because they think they have more balance and more capabilities of walking on their own in their dream. So the bed rail kind of reminds them that they're dreaming. Let's stay in bed. It also will prevent you from rolling off the bed, because rolling off the bed and hitting the floor is a fall. Next is a shower and bench chair. So similar to the rugs that can move, water is slippery. Water is not good for us for balance. So if you feel unstable in the shower or a tub, you can add a chair or a bench. You can stand up in the shower, sit down sometimes. If we get tired, you can sit down. In addition to that, you can have the rails in the bathroom. There's so many resources out there for rails and handles in the bathroom. You can get the ones that suction cup really well to the bathroom, so you don't have to hire a handyman or anything like that. You can use that in the shower. I also usually recommend it next to a toilet, so you can help pull yourself up if you're having, difficulty getting up from a low surface. Removing loose cords. Now that we're like in a very technology-based society and time, when I do home care, I'll go to someone's house and see a pile of cords, and like, we're asking to trip here. So there's many ways that we can, get a surge protector that allows them to be more organized, or maybe push them under something. Sometimes we tape them to the ground so that the cords aren't just loose and free falling. And lastly is keeping commonly used objects in reach. So if you have a favorite mug that you like to have your coffee in, or something you use often, you want to keep it in a shelf that you don't have to reach. I use the example of, I wouldn't stand on a ladder or a step stool to reach high in a cabinet. Reaching is another way of challenging our balance. So to decrease our risk, if you keep the things that you use commonly at eye level or in a close reach, not hard to get to, it usually will help decrease our risk of reaching out of our base of support. So that's our home environment. There's many other ways we can help reduce it, but those are the most common that I see, especially when I do home care and I see people's home environments. Okay, next is improving safety awareness. So safety and awareness, it's understanding you, it's understanding your limitations. We all have limitations. Sometimes we can be overconfident and think we can do more, and our limitations maybe exceed that at this time. Does not mean it can't change. And we need to our brain and our perception of our balance and strength and what we can do want to be pretty aligned with actuality, because that kind of levels out our safety awareness. If you know that you have neuropathy and your feet are tingly and you can't feel them, I definitely would not want to have a movable rug or a very slippery, wet bathroom. You have to know your deficits, know your limitations, and know your strengths. No, I'm strong, I can get up off the toilet fine. Then maybe you don't need the rail to help pull you up getting off the toilet. So I usually like to find themes, because usually there will be a common theme of why people fall through the fall history. So is it when you go up the stairs? Are you catching your toe? Are you slipping on carpet, something soft? Are you wearing shoes when you fall? Are you not wearing shoes? Are you reaching for something? Do you remember your fall? Sometimes you don't remember. It will be, I just woke up, I just kind of was on the ground. Not necessarily that you pass out, but you don't remember exactly what happened that made you fall. Or another big one is, besides dizziness, is my knees gave out. I was fine. I was standing there, I was walking, and my knees gave out and I fell to the ground. So knowing and thinking about, oh yeah, I do feel a little wobbly doing this, and oh, like this. You can ask, I'll give my contact information too at the end of this presentation. You can always ask me, I feel unsteady with X, Y, and Z. And if we can find a theme, then we can really enhance our environment and our body and mind to decrease our risk. But that's a little bit more individualized and understanding you and how you are today, which may be different from tomorrow. Proprioception deficits, we want to know if you feel your foot in space. There's a lot of testing we can do. And this slide I know is more individualized, but it's something you should think about for yourself and see if you can relate to anything I'm saying. Next is visual impairments. So if you have glasses, if you need contacts, how's our vision? Maybe the night lights would be even more, or maybe you need to make sure that you have your glasses right on your nightstand. Little things to help your awareness and how you perceive your balance. And the last is vestibular dysfunction. I treat a lot of dizzy people, and dizzy can mean so many different things. I know my clients don't really like when I say, well, can you describe your dizziness? It really tells us a lot, but understanding what makes us dizzy, what makes us feel, sometimes we say on a boat, feeling unsteady, that's our vestibular system. Understanding you will help us reduce the risk. And I'm happy, really feel free to reach out. I'm happy to go through any of these with you on an individual level. Next is strength. That's a little bit more universal in this slide. It's good for all of them. I had to pick out 5 things that I was like, these are good functional strengthening things that we can use and muscles we're intending to use to decrease our risk. Our legs, they have to be strong for us to walk, for us to get up off a chair, for us to roll in bed, for us to go upstairs. If you don't have the strength, then the weakness that we might have is working against us and can increase our risk for falls. So I'll go through these 5 that I think if you feel safe doing, they're great exercises that you can do every day and at home. So the first one, sit to stands. It's as simple as it sounds. You sit down, you stand up. It's basically a squat. So you can do this with an imaginary chair if you feel safe. You can do it like in the picture, the first picture here. You can do it with your hands on thighs. You can use a chair with arms. You can use it with a counter in front of you and help pull yourself up. There's many ways, many levels you can do this. If you feel the seat is too low, you can add a big cushion to the chair to elevate your surface. You want to find a surface, an area that you can do this, that you feel safe, but you're also able to get reps in, 5, maybe 10. Maybe you start with 1 and build it up, but that's how we'll build the strength in our legs. We're using multiple muscle groups here. To the right of that is bridges. So bridging, not always a fan favorite, but it helps us scoot in bed, helps us scoot in the chair, move forward to get out of the chair. It helps us roll in bed. And also our glutes, it works our glutes so strong, and that will help us get up out of a chair, go up the stairs, roll, as well as our hips really need to be strong. Our hips help us so much with balance. Our hips and ankles are one of the most important things I always work on to decrease our risk for falls. And if someone's coming to me to work on their balance, I can almost guarantee that their hips or ankles may have some deficits. So bridges is a great one to kind of work in. Next is step ups. Step ups is if you feel safe, right? Everything's always if you feel safe if you're not practicing this with a provider. So if you have a staircase at home, you can hold onto the rail and just step up and down the first step. Again, you can work your way up in reps, but this is similar to a sit to stand in a sense. We're working similar muscles, but we're working one leg. So maybe we have one leg that needs a little more work than the other leg. This is a good way to strengthen it without totally compensating with the other leg. Next in the center here is side steps. So she's at it looks like a kitchen island. You can use an island, you can use a counter, you can use your bathroom sink, and it's stepping side to side. I talked about hips. This is working the outside of our hips now. This will help us walk more normally and stabilize our pelvis to decrease our risk for falls. And lastly, I added here marching. I add marching for many reasons. It's one of my favorite exercises to do for so many different things. Here she's holding on, which I would always recommend at first. But you can also progress this to adding weights on your ankles or standing on an uneven surface. Marching is so good because it helps improve toe clearance. So if you find yourself tripping on your feet or tripping on a carpet or tripping on a stair, going up the stairs, and you're not able to lift your knee up, it could be from strength, it could be because you don't feel where your foot is in space. This will help increase and get that motor memory to increase the height of our steps and improve toe clearance. as well as it gets you in single leg stance. Every step we take, you're in single leg stance. To put one foot down, to step other foot forward, you're on one leg. So standing on one leg is so important. It's very hard to do. Do I expect you to be able to try this one day today and not hold on and just go for it? If you can, awesome job. Love it. But this is a good way to help with a little bit of hand support. And then maybe you lose one hand and only hold on with one hand. So if I had to pick 5 good strengthening exercises to do every day, these are them. Next is proprioception. It's a big fancy word for telling your limbs where they are in space. So this is where I talk about ankles. We need ankle strength, and then we have to know where our ankles are in space. If you have any swelling in your ankles, that can decrease how we feel we are in space. If you have any tingling, numbness, anything like that, that can impair it. Also, depending where our brain injury is, it can affect our sensation and how we perceive sensation. So this is a good one to work on for all, as generally, just in general, our proprioception will decline with age. So this first one is the girl laying down, and what she's doing is just pointing and flexing her foot. So you can do this in bed, you can do it sitting. It's moving your ankle. In addition to having good ankle mobility with this, that will help us kind of get that little wiggle room if we do feel off balance. It also can add a cognitive and proprioception component. You can say, my toes are going in, my toes are going down, and retraining our brain. And maybe you're looking at your toes as your toes go up and then your toes go down. If that feels easy, you can take away your eyes, close your eyes, and then say, my foot's going in. Then maybe open your eyes and see if their toes are going up. And it's a good, simple way you can train. You can do it in bed. It's so good for so many things we do. Our ankles are our first line of defense in preventing falls. You'll feel your ankles go wobbly first. So feeling where our ankles and feet are in space are really important. I already spoke about standing on one leg. So here's a picture of her standing on one leg. You can do this by holding on to something. You can lightly tap the other foot if we're not ready to put all our weight on one side. You can let go, or you can also add a more pliable surface like a carpet or something squishy. Sometimes I'll use like a couch cushion, something not super, super soft, but something that gives you squishiness. Over here, down here, we call this tandem, narrow base of support. So it's another way that you can build up to single leg stance and also challenge our balance. So it's one foot in front of the other. Definitely, it's fun to see if you do the right foot in front and then the left foot in front. Notice if there's differences from side to side. A general rule is your more impaired side is when that foot's in the back, it's more challenging. By decreasing our base of support, it makes us more stable up the chain, up through our body, which then decreases our risk for falls. Lastly, I have this girl here. She's on a foam pad. Been to physical therapy. We love our foam pads. You can do this with a foam pad. You can do this with a cushion. You can do this with a carpet, just changing the surface. But you can see her feet are all the way together. So it's another way to challenge our base of support. And then you can have some fun with that. You can do some head turns, you can close your eyes, you can sing, you can do a riddle, all the fun things to kind of make it more challenging. You can also hold on to make it easier. All right. Our last balance system is vestibular. So vestibular means our equilibrium in our brain and our ears. We have our inner ear organ and we have our brain. They connect together and our eyes perceive it. So often when you feel dizzy, which is different than lightheaded is that sensation of when you sit to stand, that orthostatic hypotension. That's kind of like its own little category. But other dizziness, like you feel like you're on a boat, or you feel spinning, or you feel like the waves, or you can't concentrate on a word, that's more vestibular. Even if there's many reasons why our vestibular system can be impaired, from the brain to the ear or to the eyes. Like I said, we can sometimes fix it. If it's positional vertigo, we can fix it pretty quickly. Or it might be something that has changed over time and that's our vestibular system, and that's what it's going to stay like. However, we can habituate, meaning getting our brain adapted to this inner ear, or the inner ear adapted to our brain, that we can reduce the symptoms that will help us reduce our risk for falls. So these first two top pictures, they're called VORs, vestibular ocular reflex. That's the reflex that connects our inner ear to our eyes to our brain. So what she's doing is holding a target. I will use my finger, a pen. Here she's using like an index card. You find a target, you move your head left and right, small range of motion, and you want to keep your eyes stable on the target. You don't go as fast. You don't go fast if the target starts to get blurry. If you get dizzy, you stop, let it settle. The difference between the two pictures is one she's turning side to side and one she's turning up and down. They're great tasks for us to do to kind of calm down our dizziness and build up over time. The bottom two ladies is something called smooth pursuits. So if you find yourself difficulty staying on one line when you're reading, or sometimes if you're driving, or if you're in a car, or if you're at a grocery store and there's colorful movements next to you as you're going down the aisle, or cars passing next to you, sometimes we have some gaze instability. So you take your target, you gaze up, you follow the target going up, you bring it down, and you kind of make a cross going to the side and side. The goal is to trace the target and having your eyes move without your head. So the top one is moving your head without your eyes, and the bottom one is moving your eyes without your head. This gentleman down here, I know it's hard to tell because his eyes, you can't see as well because he's facing this way, but it was the best image I could find. Eyes closed. So if you take out your vision, then you're only working on your proprioception, your feet, and your vestibular system. So the most challenging way to really challenge our vestibular system is eyes closed, taking out vision, and then stepping on something unstable, or in this case, he's bringing his feet together by decreasing the base of support and challenging the other systems. I know it's a lot of information. If you take one thing from one slide, I'm happy, because one thing can really decrease your risk for falls. So that all being said, all the things we can do to reduce our falls. If a fall happens, then what, right? Sometimes we'll be in a situation and it just happens. First comes to first, do a personal assessment for injury. Is there any blood? Did you hit something? What'd you hit? Your head? What's happening in your body? If you're able to do this assessment, or if you're with someone that can kind of do a quick scan, seeing if there's anything obviously injured or something you feel obviously injured, that's step number one. If you feel safe that you can move, I will always say, try to move to something that you can hold on to. So say you slipped on an area rug in the middle of your living room floor. If you're able to and you feel safe, to crawl over to the couch or a stationary chair to help use your arms to get up. That's usually the safest and also most energy conserving way to get on the floor. Or maybe you can crawl over to your phone or something in the house that you could call for help. I posted in this bottom corner over here, there's so many out there, call bells. So if you're at a risk for falls, and especially if you're there's a time that you're home alone, that's a really good thing to have. They have necklaces, they have bracelets, a lot of phone apps you can have that if God forbid you have a fall, that you can call someone and get immediate help. But always assess, see if you can call for help. And then if you feel safe and you feel like you can get up, this top picture shows him crawling over to a chair and using his arms, not just his legs, to help rise up, which will help because you can also fall again trying to get up. Next is rest. Falling and then getting off the floor can be a lot for our body. We need to honor and give ourselves grace, and we often need rest. I'll always recommend after any fall that you do receive medical attention, whether it be if you're seeing a physical therapist regularly, they can usually do a quick assessment and see if you need further care from a different practitioner. Or you go to your primary care doctor and they'll do a quick screen to again see if you need any other testing. Most definitely, if you hit your head, always need clearance. You definitely don't want that. So this is like last case scenario. If we do fall, there are steps we want to take to rise safely, recover, and then again, preventing with everything else I talked about. These are some resources they're active links, you can click them. Love Your Brain. I'm certified in this course. I'm a yogi. I love yoga for myself and for others. I do a lot of yoga classes for people with neurological diseases such as brain injury, Parkinson's, MS, and I've seen such incredible transformations with my clients. Love Your Brain in particular is a nonprofit organization for yoga with people with brain injury. It's a fantastic program. They allow the program to be pretty adaptable. So this is the link you can look up to see if there's facilities around you that have this program. The program was initially designed for a 4-week program, 2 to 3 times a week. You go in, you get this boost of yoga benefits and techniques that you can use to take out. It's very inclusive. There's many options, there's many levels, there's multi-level. You can bring your caregiver, and it could be a dual beneficial. You can bring a significant other. There's so many good options for this. And with this, a physical therapist and a yoga instructor, I have both. So I usually am the facilitator for this in my situation. We design the class to get the yogi benefits, to decrease stress, to improve our mobility, improve our strength, improve our balance. That in itself will help decrease our risk for falls. The next link I wanted to put in there was the YMCA. There's YMCAs all over, and a lot of them have really great programs. They have balance workshops, they'll have guest lectures. I know I'll pop into my local YMCAs and do a free balance assessment just to kind of see where we're at. There's a ton of classes at YMCAs that might be, if you feel better exercising and strengthening and working on your balance in a group setting and building that community, this is a great option for you. And lastly, I know I'm a little biased as a physical therapist, but having a risk for falls is medically necessary, and you should get therapy for it. If you have an insurance that physical therapy is based on medical necessity, having a fall history and having a risk for falls makes you medically necessary. So it's definitely something to look into, even if you haven't been to PT in a while and you want to go for an assessment. It's a great thing to do. They'll tell you your individual needs or your strengths, and you can kind of adapt your program to yourself a little bit better, especially when I was talking about safety awareness. These are resources that I pulled some of my statistics and some of the facts from. If you guys want to head there, that's awesome. They're great resources. And now the floor is open to you guys if you have any questions for me.
Thanks so much, Marvelyn, for all that really helpful information and great strategies and practices that we could do at home. So very great. Now's the time to open up to you all. If you have any questions, feel free to put those in the Q&A and I can read them out to Marvelyn. We have somebody saying, thank you, Marvelyn. They're a brain injury survivor since 2016. So
Awesome. Thank you for joining me.
any questions? Let's see here. Lots of thank you. Amazing. Great presentation. Good stuff. Any questions?
I also have my on the next slide, I have contact information. I am a nerd. I will reach out. Anyone that has any personal questions, doesn't want to do it in an open forum, that's my email. That's the best way to contact me. I'm pretty good on my email. And then if anyone has Instagram, that's my Instagram. That's more for more general things, but I do post a lot of exercises and techniques and different things like that. So it's another resource if you're interested, something different to look at.
Great, thank you. Any questions? Pretty quiet group today. You just did such a fantastic job.
It was a lot of information.
No, but I appreciate it. It was very practical. I was just thinking about this. A lot of, I even get questions too when I go out into the community about fall prevention of like, are there like specific exercises that can be done? And like, this was just very practical. So thank you for that. Well, I'll give a last call for any other questions. Otherwise, you can have 15 minutes back to your day.
Well, thank you guys so much. Oh,
Oh, we got one. All
yeah,
right.
cool.
Does coordination and balance help with balance?
Yeah. So definitely they're very correlated. Coordination can I kind of bring them together because the reason of why our coordination may be impaired could be due to a vestibular system issue or a proprioception issue, or just from having a brain injury if it's more of a global injury. So that's why I didn't touch on coordination with too much, because I classify it with balance, and I do my balance testing with coordination testing, and that's where I bring it a little bit more specific to the client with coordination. A good, if you want a good task you can do at home is if you're doing any vestibular exercises that I may have mentioned, you can take your popsicle stick or your postcard or something on the wall and do nose to popsicle stick and seeing how we can do it. Or you can rub your heel, your shin. There are great ways to practice coordination as well.
Thank you for that.
Thank you for sharing.
Wonderful. Well, I put in the chat the link to the post-webinar survey, so please feel free to complete that when you have time. Again, if you're looking for a certificate of attendance, you need to complete that. Another question we have, if a fall is unpreventable, are there any tips for falling safely? That's a really good question.
Yeah, that's an awesome question. Definitely. I definitely will do training for people that I work with that have a lot of falls, and if it's going to happen, what do we do? First and foremost, protect your head. We always protect our head. So a good way to do that is kind of reach out in front of us. Granted, other injuries can come from that, but always protect your head over a limb. That's usually my number one rule. If you kind of feel like you're losing your balance and you're unable to kind of catch that, like kind of what you're saying, an unpreventable fall, if you can hold on to something stable to try to slow down your falling or allow you to land more softly, that's better. Or if you can quickly get yourself to a seat, and even if we're still going down, if you almost use it as a slide to slide down more to the chair, these are ways that you can reduce any injury that could come with the fall. And then as we get stronger, slowing down a fall is much easier. And just practicing getting on and off the floor is a fantastic skill and always advocating for. But in the moment, quick tools to think of is grab onto something stable, definitely not something moving, or slowly decelerate yourself by grabbing onto something or sliding down a chair.
Thanks, Marlon. When you say protect your head, would you suggest like covering your head, or how would you do that in the moment, maybe?
Yeah. So protect your head. What I think of is, I think if you're slipping and you're going forward and you see your face coming toward the ground, I would use my arms out in front of me to not have my head have the initial impact. If you're going backwards, yeah, you can cradle your head so you're not hitting your head so that you hit your back more. Obviously, we don't want to have any injury, but as we know, and even more specific to this group, protecting our brain is number one. So if you're going backwards, I usually take your chin a lot so you don't hit the back of your head. And if you're going forward, reach out to try to brace it with your arms.
Mm-hmm. Great. Thank you. Awesome. Well, I don't see any other questions. So if you have other questions, you can feel free to reach out to Marvelyn, or I'll put my own email in the chat. You can reach out to me and I'd be happy to pass along your question and have it answered. And otherwise, thanks again for coming. Thank you again to Dr. Tiziani for all of your expertise. It was fantastic. And just a reminder to complete that survey if possible. The link is in the chat. Otherwise, thank you so much for attending and for all of your questions and comments, and we hope to see you at our next webinar. This concludes today's webinar.
Thank you.